Welcome to the Ask Dr. Tommy O Show. The Ask Dr. Tommy O Show is a community outreach show, which is a non-for-profit health community education show. This show is geared to meet the community needs. I have the privilege today to be in the South Bronx, in the South Bronx Pharmacy. We're going to discuss what the role of the pharmacist is. Tonight I am here with pharmacist Maurice Cohen and general manager Francisco Garcia. Welcome
Good evening.
to our show.
Good evening. Pleasure to see you.
Well, before we get into today's show, I just want to go over some important points. What this show is about is let's make a difference in our community. What this shows and the Ask Dr. Tommy O Show is about being proactive, making a difference in this community, and that's what South Bronx Pharmacy is all about, making a difference. Again, the topic is about the role of a pharmacist. So let's get into what is a pharmacist. Can you define what a pharmacist is?
Yes, a pharmacist is the person in the health team that fills the doctor's recipes, his orders. We fill the prescriptions according to what the doctor wants, and then we look to see if the patient has any other doctors and if there's any medication complications, interactions.
Right, so you'd be an extended provider.
Extended provider, yes.
Right, so you would also be what we call continuity of care. If there's any differences or something that you need to adjust, you would make the phone calls and communicate with the physicians.
Definitely, definitely. That's our job.
As a general manager, what would your responsibility do?
Well, we have to make sure that we handle the community properly, that we take care of our customers, that we make sure that whatever is wrong, we correct. If there's a problem, we go after it.
Okay. I'll give you an example about a lot of times there'll be a discrepancy in maybe a prescription that I write or from another physician, and then I'll know you'll give me a phone call or you'll come directly over to my office and you'll question me about this particular prescription. Is this correct? Is this amount correct? So that's part of what your job is.
Definitely. Because our job is really to make sure that the people are healthy.
That's correct. And that's, again, part of the continuity of care. Now, what would be the qualifications, or if one, let's say a viewer out in the major metropolitan area, if they wanted to become a pharmacist, what would one have to do?
Well, you finish your academic high school career, and then you apply to pharmacy school, which is a 6-year program now. And or you can go to a junior college for 2 years and then continue for 4 years in the pharmacy school, and then 1 year of internship.
Internship.
Right.
Now, do you have to be board certified, special exams that you have to take?
Yes, we take exams after we're finished our internship. And now you can be board certified in certain subjects, in
right.
intravenous medicines and so on.
Also, I know that you're having doctorates. Certain programs have doctorate programs in pharmaceuticals.
Well, everybody today does graduate with a doctorate. Everybody does get a doctorate. That's their title. It's no more bachelor in science. It's a doctorate in pharmacy.
So you're
right.
a PharmD.
PharmD, you got it.
Okay, good. Now, how long have you been in this community serving the South Bronx? And this is the Mott Haven section.
5.5 years. 5.5 going on 6 years, yeah.
And how many years have you been a pharmacist?
Oh, about 64.
64 years.
Yes, the reason I say that is my mother, father were pharmacists, my grandfather, my uncle, so I just came out of pharmacist, but I had to wait a little time to get to the school. I had to finish my high school education, and then I could go to pharmacy school, so a little joke there.
That's it.
Yeah.
So that's a long time. Something that's passed down. You find out in medicine that a lot of careers or professions or disciplines within medicine is passed down from generation to generation. Now, what would an individual look or seek in a pharmacy? If they went to a pharmacist, what's important? What do you offer and makes you special compared to a different pharmacy? What would you want to offer, make special?
Well, we watch the patient as an individual. We watch the patient. It's not only having the finest computer system and counting machines, but our personal interaction with the patient.
Right.
We watch them like their family. You know, so we make sure that everything is done correctly and they are not mixing medicines or mixing doctors.
Not just a number.
Just not a number, correct.
Right. And I'll give you an example. Again, walking in a neighborhood, I'll see both of you out in the neighborhood carrying bags and making home deliveries where you don't see in a larger chains. And that's something important, where you have that homegrown family feeling.
Yes, that's true, and we also pick up the prescriptions besides delivering them, so you can stay in your house. You don't have to move if you're incapacitated. We get there and pick the prescriptions up and get them over to you as soon as possible.
There you go. So again, that's important when you're seeking a pharmacy and you're seeking out a pharmacist. One, you want to make sure they're board certified. They're certified. They have a PharmD degree. You also want to make sure they have a family-oriented environment, so you're just not a number, so you're just not a statistic in the computer. Again, most pharmacies will cater to your needs, and that's something that's important. It's just like you're coming to the physician. One, you have to demonstrate continuity of care between your physician and your pharmacist, and the pharmacist back with your physician, because we have that type of communication here. If there is, like I said, a discrepancy or something not sure about, or let's say if I write a prescription and the amount is just off by a little bit, maybe a prescription was changed, like a formula was changed, and I didn't know that they changed the formula, immediately I'll get a phone call from you and saying, well, this medication was discontinued and this is the new amount. Is this appropriate? And that is what we call the continuity of care that you get with a family-oriented pharmacy. Now, since we're here, you said you've been in this community for the past 5 years. What type of community services have you provided?
Well, as I said, we pick up the prescriptions, we deliver the prescriptions, we counsel all our patients in English and in Spanish, and we have printouts for the patients besides the counseling, and we deal with we care.
Right.
Personal touch.
Also, I'd like everyone to know that I've put on several charity events within our community, especially this summer, and the South Bronx Pharmacy has donated the supplies to help make a difference in our community, because a lot of this costs a lot of money, and the donations and the